Information hearing to order. This morning, we're going to be addressing California's adaptation efforts to climate change impacts on environmental quality and our public health. So welcome to the first of a series of informational hearings of the Senate Environmental Quality Committee. We all know from the ever-growing body of scientific research that the climate is warming and that this changing climate has serious impacts for California. Already, we've seen rising sea levels, an increase in average temperatures, and diminished snowpack. Now, throughout California, the frequency of extreme events, such as extreme heat waves, extreme wildfires, extreme floods, and extreme droughts are expected to increase. These events will have a range of profound consequences on our air quality, the water quality, and the public health. Now, currently, the impacts from climate change can be felt on California's ongoing drought, the nature of which is likely to worsen due to the record temperatures across the state, with severe job losses and an estimated $2.2 billion price tag for California agriculture. Furthermore, drought conditions and increased temperatures can facilitate the spread of diseases such as the West Nile virus, cases of which doubled in California last year because of higher temperatures, and even small pools of stagnant water led to increased virus production and populations of mosquitoes that spread it. Frightening to think that during our 4 drought years, we'd have increased mosquito populations. Now, the reduction of greenhouse gas emissions are critical to the ongoing efforts against global warming. And our colleague, Senator Pavley, has been a leader in climate mitigation and the policies set forth in AB 32. Because climate changes so slowly, however, even if all greenhouse gas emissions were to cease today, we would have to contend with the ongoing impacts of climate change from our carbon emissions in the past. Therefore, we believe that in addition to the need for continuing mitigation measures, a comprehensive adaptation and resiliency policies must be incorporated into the state of California's overall climate strategy to better protect our communities from unavoidable impacts of climate change. We'll begin today with an overview of our climate change impacts on environmental quality and the public health, as well as environmental justice concerns from the Public Health Institute. Then we'll move to our panel of 4 secretaries of agencies and offices of the governor and so forth that are working on planning for climate change impacts. Our third panel will feature representatives for the Alliance of Regional Collaboratives for Climate Adaptation, which is a regional, confederation, and the local government commissions, who will be speaking on regional and local adaptation efforts and also addressing this communication or lack of communication with the state. To wrap up, we'll have an independent perspective from the Little Hoover Commission on the picture of climate adaptation efforts across governing levels of California, with their recommendations on how to improve adaptation, followed by our public comment period. As you know, I'm hopeful that this hearing will provide us with a better understanding of the current state of adaptation planning and implementation throughout the state, and help inform ongoing conversations about how the state, regions, and local government and organizations can effectively work together to improve the climate adaptation responses to a changing climate. Before we begin, I do have a couple of notes. First, in the interest of keeping the hearing on schedule, I ask that we keep our statements brief and our questions concise. Also, there's a change from the original agenda that was posted. From the Governor's Office of Planning and Research, Director Ken Alex was unable to attend, so I'm pleased to have Deputy Director Louise Bedworth speaking for us today. With that, I'd like to thank all of you for joining us and invite members of the committee, Mr. Leno, or Senator Leno, if you have any comments to make. Otherwise, we shall begin. Proceed. All right, our first panelist is going to be from the Environmental Quality and Public Health in California, are speaking on environmental quality and public health in California, Ms. Linda Rudolph, with the Public Health Institute. And you'll be providing us with an overview. Thank you for putting us on your schedule today.
Thank you so much for inviting me to participate in today's hearings and for your interest in this increasingly urgent issue. I'm currently the director of the Center for Climate Change and Health at the Public Health Institute. In my former role as deputy director for chronic disease prevention and health promotion in the California Department of Public Health, I served as the founding chair of the Strategic Growth Council Health and All Policies Task Force and the founding chair of the Climate Action Team's Public Health Work Group and the lead author on the 2009 Public Health chapter of the California Adaptation Strategy. I want to provide a brief overview of the human and health impacts of climate change and then offer several recommendations. Climate change is the greatest threat to public health of the 21st century. People in California are already experiencing the human health impacts of climate change, and these will continue to increase. Climate change threatens the systems on which human life depends: our air, water, food, shelter, and security. Direct impacts of climate change on health are those associated with the increasing frequency and severity of extreme weather events such as heat, floods, wildfires, and drought. FEMA and the Centers for Disease Control estimate, for example, that there were over 1,800 deaths and 7,500 injuries following Hurricane Katrina. Extreme rainfall can also cause water contamination with sewage and toxic pollutants and damaged crops. Heat is already the cause of more deaths than any other kind of weather-related event. There were 655 excess deaths in California's 2006 heat wave and over 70,000 excess deaths in Europe's 2003 heat wave. Many heat deaths occur in urban heat islands. The very young, the very old, those with medical conditions, and outdoor workers, like agricultural workers, are at higher risk. Climate change also affects health through impacts on the natural environment. For example, temperature and moisture changes lead to change in the distribution of disease-carrying vectors such as ticks and mosquitoes. The Aedes aegypti mosquito, which carries dengue and chikungunya fevers, has recently been found in the San Joaquin Valley in Southern California, and dengue is now endemic in the Florida Keys for the first time since before World War II. Ground-level ozone levels rise almost linearly with rising temperatures, increasing risks for asthma, other respiratory illness, and heart disease, and creating a climate penalty that may undermine our progress in reducing air pollution. Warming fosters worse allergies through high pollen production and a lengthening of the pollen season, which is already more than 3 weeks longer than normal in many parts of the United States. Climate change impacts on health and well-being are also mediated through human, social, and economic systems: job loss, social disruption, forced migration, and conflict. In 2005, hurricanes severely damaged or destroyed 126,000 housing units and damaged another 1 million. A recent Department of Defense report concluded that climate change is an immediate threat to U.S. national security because it adds to the challenges of global instability, poverty, food and water shortages, and conflict. Senator Wieckowski already talked about drought and mosquitoes, but drought provides a really good demonstration of the wide variety of impacts associated with a single climate phenomena. I needn't remind you that humans cannot survive without water. Hundreds of California families in poor rural areas have lost their water supply for drinking and bathing, becoming reliant on bottled or imported water during this drought. Due to the drought, thousands of acres are lying fallow, and ranchers have reduced their livestock herds. As a result, food prices are likely to increase. Rising food prices lead to higher rates of food insecurity, and we know that food insecurity is associated with increased risk for diabetes, obesity, and cardiovascular disease. Drought and warming increase the severity and frequency of wildfires, which put firefighters at direct risk, but also send huge plumes of smoke into the air. And these plumes can travel hundreds of miles to 1,000 miles to cause very poor air quality over large areas for weeks at a time, with associated respiratory and cardiovascular disease impacts. Drought and heat create dust that may also carry the spores of fungal diseases such as valley fever, a silent epidemic across the Southwest. The California Department of Corrections now must preclude the placement of African Americans and other high-risk inmates in certain prisons to prevent a further rise in the valley fever epidemic in our state prisons. Drought brings other significant costs other than those that the Senator mentioned. The National Climate Assessment states that for California, quote, climate change will increase the cost of maintaining and improving drinking water infrastructure by increasing the need for wastewater treatment and water desalination to supplement water supplies. And drought, for obvious reasons, is associated with depression and other mental health problems. Climate change disproportionately impacts people of color in low-income communities and thus serves to exacerbate already unacceptable health inequities. Population health status is largely determined not by health care, but by what we call the social determinants of health. Some neighborhoods have great parks, nice tree-shaded sidewalks. Others have asphalt playgrounds near busy freeways. Some have farmers markets. Others have liquor stores and convenience stores. These differences shape people's health behaviors and result in differences in life expectancy of up to 15 years from one zip code to another. What does this have to do with climate change? Climate vulnerability is the degree to which individuals and communities are susceptible to the adverse impacts of climate change. Climate resilience is the capacity to respond effectively and still thrive in the face of climate change impacts. Some of the most important components of vulnerability and resilience are health status and living conditions. So people who live near busy roadways or in areas with high levels of ozone are already at higher risk of asthma. People with asthma or heart disease are more vulnerable to the effects of ozone, which increases with warmer temperatures. As drought reduces surface water availability, groundwater becomes a greater source of drinking water. But in much of the Central Valley, groundwater contamination with nitrates is extensive. Low-income people are less able to cope with rising food and water prices and less likely to have insurance, reducing their ability to recover after a natural disaster. Pre-existing illnesses such as heart disease and diabetes increase the risk of heat illness, and low-income neighborhoods often lack healthy tree canopy, further increasing the risk for heat illness. Many climate and adaptation strategies have very positive impacts on health, and routine assessment of the health consequences of our climate actions can optimize the significant health benefits and healthcare cost savings potentially associated with climate action. Low-carbon fuels, zero-emission vehicles, and fuel efficiency all reduce air pollution and thus reduce cardiovascular and respiratory disease. Active transportation, walking, biking, using public transit, also reduces air pollution, but it's the only of our transportation mitigation strategies that increases physical activity. A feasible shift from driving to active transportation could yield a 12% reduction in heart disease, stroke, and diabetes. And this comes from work that Dr. Maeslish from the Department of Public Health has done. That's a huge public health benefit. But without careful attention to safety, we could also see a significant increase in bicycle and pedestrian injuries. Clean energy reduces air pollution, sustainable local food systems, reduce pesticide illness and water contamination and antibiotic resistance. Urban greening with trees, parks, urban agriculture, and community gardens not only sequesters carbon dioxide, but reduces the risks of heat illness, reduces air pollution, stormwater runoff, flood risk, crime, replenishes our groundwater aquifers, creates more places to be physically active, supports social networking, and reduces energy use. What's not to like? Not every climate intervention strategy has positive human impacts. Biofuel production may lead to rising food prices. Market mechanisms such as cap and trade may result in the continuation of high air pollution levels in fence-line communities near toxic sources, perpetuating health inequities. Mitigation and adaptation are both essential. Without rapid and substantial reductions in greenhouse gas emissions, the risk rises that climate disruption will overwhelm our adaptation capacity. We must plan and prepare for climate impacts and promote climate-resilient communities. The best way to build long-term climate resilience is to promote healthy and equitable communities. and increase community capacity to understand and respond to climate risks. Many of the agencies responsible for safeguarding the health and well-being of California residents have not yet adequately engaged to address the health impacts of climate change. While health systems such as Kaiser are working diligently to reduce their carbon footprints, few have really assessed the climate vulnerabilities of their facilities. There's a need to build awareness that climate change is not just about polar bears, but it's about us and our kids and our grandchildren. Over 75% of physician members of the American Thoracic Society and over 60% of those surveyed in the National Medical Association report that they are already observing the health impacts of climate change among their patients. Yet Americans are generally unaware of the potential health consequences of global warming, with only about 1 in 4 able to name even one health problem related to climate change. When people do understand the health impacts of climate change and the health co-benefits of climate action, they are much more likely to support robust climate action. To summarize, climate change poses a profound threat to human health and threatens the basic systems on which human life depends. That is why the editor of the internationally prestigious British Medical Journal recently called on the World Health Organization to declare climate change a public health emergency. I want to briefly share a few thoughts about how we might begin to address climate adaptation and resilience from a public health perspective. 1, incorporate climate, health, and equity considerations in state and local policies, planning, investments, and programs, and promote climate mitigation and adaptation strategies that optimize health and equity co-benefits. A climate, health, and equity-informed transportation infrastructure plan, for example, would place far greater emphasis on public transit, safe bicycle and walking infrastructure, more rapid and robust implementation of complete streets, and the use of cool pavements. Climate, health, and equity-informed land use planning would prohibit the placement of critical infrastructure in areas at risk of sea level rise or flooding, ensure displacement protection and affordable housing and transit-oriented development, build energy-efficient and healthy multi-unit housing, and incorporate urban heat island reduction strategies, including trees and greening. 2, support and promote active engagement of all communities in state and local climate planning, preparedness, and resilience efforts. The substantive involvement of diverse community members supports social cohesion, a key piece of resilience, identifies important community assets, and enhances the development of feasible strategies and engenders support for their funding and implementation. 3, implement a coherent statewide social marketing campaign to increase recognition of climate change as a human health issue and to promote greater support for necessary climate mitigation and adaptation actions. And 4, greater engagement and resourcing of the California Department of Public Health and local public health agencies are required to improve protection of California residents from the impacts of climate change and to optimize the co-benefits of climate action. Our public health agencies need leadership, resources, guidance, and workforce capacity development to assess climate health vulnerabilities, to monitor and forecast the impacts of climate change and climate change strategies on health and health inequities, to ensure that health and equity are considered in climate and adaptation mitigation planning, and to promote community resilience to reduce the impacts of climate change on health and human well-being. For example, we need more accurate and timely surveillance for heat illness, more sensitive and consistent heat warnings, and more comprehensive urban heat island reduction programs. We need an updated assessment of the climate vulnerabilities of vital public health infrastructure, such as wastewater and drinking water treatment facilities, and a more focused effort to assess and prepare for the impacts of climate change on our healthcare delivery system. Better coordination of and accountability for climate adaptation and resilience are needed. The state's adaptation strategy identifies nearly 20 agencies with responsibility for public health related to climate change, in addition to multiple local and regional partners. yet none of those are mandated to address the health impacts of climate change. In closing, our best long-term protection against the health impacts of climate change is to redouble our efforts to reduce greenhouse gas emissions and to promote healthy and equitable climate-resilient communities. California's climate mitigation program has benefited from clear mandates, leadership, and significant resources for implementation. I suggest that we need the same and quickly to build adaptation capacity and climate resilience to protect California residents from the impacts of climate change on human health and well-being. I thank you again for your interest in addressing this important issue.
Thank you. We'll welcome Senator Jackson to the hearing. Oh, and Senator Bates, too. Both of them are here. We talked, your testimony, thank you for the testimony. We sometimes talk about one phenomena. We talk about drought. Can you help me out on the duality or the trifecta of different phenomena and the different impact that they would have on public health? Let's say after you have a drought, then you have extreme rains, or you're in the Bay Area and you have sea level rising.
Yeah, well,
different outcomes.
Many of these natural phenomena are related. So we know that heat and drought together further exacerbate the individual impacts of either one on drying out the soil, which creates more dust, or of increasing the risk for wildfire. So there's some, interaction among these different impacts of climate change that add to the magnitude of the health risks. And of course, I alluded to the concept that pre-existing health status is one of the underlying vulnerabilities for climate impact. So in Hurricane Katrina and Superstorm Sandy, one of the biggest problems that people faced was that people with chronic illness had disrupted medical care. They couldn't access their prescriptions. They evacuated without their medications. So people that had chronic illness had exacerbations of their chronic illness because of the disruptions in the medical care system. Does that?
No, thank you. Questions from other senators? Senator Leno.
Thank you, Mr. Rudolph. It really is forever yet further eye-opening of the ramifications in every aspect of our lives. As Senator Wojtkowski had just mentioned, so much of our initial steps in approaching adaptation actions that we may be taking mostly around how the environment's going to change and how we have to adapt to it, but how our own health is going to change is even more daunting. A number of things that you said stood out for me. Clearly, public awareness is very important, and I think that from any number of polls that we've seen in recent years, public awareness of the fact of climate change, before we can get to some of the consequences of it, are finally beginning to take root, though it doesn't seem to be a burning issue for people yet. Of course, the economy and jobs, immediate impacts to individuals and their families are always at the top of the list, which is challenging because public sentiment has to be with us as we move forward, or it won't get done. I think you said it was out of a British journal that there was a suggestion that a health emergency, am I using the right words?
Yes.
Might be declared. And it's a curious suggestion. On the one hand, it may begin to address the lack of public awareness. At the same time, it's a fine line. One wouldn't, or we collectively wouldn't want to frighten the public in any way. And of course, there's always the downside of you scare some folks and then people forget about it in the near term. Are there any projections we've got in our packet, and we've probably all seen some of the projections for the increase in temperature over the next 10, 20, 30, 40, 50 years? We've got extreme heat days across the state as one example. So there are scientists who are doing those kind of projections with regard to our physical environment. Are there projections as to how rates of asthma will increase, how different rates of diabetes and some of the other ramifications you mentioned?
We're just really starting to figure out how to go from climate forecasts to health projections, and perhaps Dr. Maeslish from CDPH can also address that issue. But I think it's an area that needs both further research, development of better tools that are easier for local public health departments to use, because many of these impacts are local, and better surveillance for, real-time surveillance, for example, for heat and other known climate-related illnesses. I think your point about balancing the gloom and doom and our ability to, take action so that people don't disengage and walk away saying there's no point in doing anything is really important. And, when the tobacco prevention campaign in California is one of the most successful public health campaigns ever. Over a period of about a quarter century since the inception of Prop 99, we saved about 1 million lives and about $88 billion. But that took a lot of research on what communications messages work, a very, very active social marketing campaign, and a real mobilization of public health resources assisted with the tobacco tax to implement a very broad and comprehensive campaign. And we really need something like that to address the human and health impacts of climate change, and yet there's essentially no funding, especially at the local health department level, to do anything like that. And so the few local health departments, and there are a few, Los Angeles, Santa Clara, San Luis Obispo, Los Angeles, most notable among them, that are starting to take up this issue, are doing it, really out of their own hides. But to really start doing the kinds of projections and planning that are important, we have to find a way to support local health departments with tools, training, and resources.
There's never a good time for something like this, but certainly this is an especially challenging time just because the state of our healthcare system in and of itself, with an aging population and epidemics of autism and dementia and type 2 related diabetes and such, we're already
if I may, public health is all about prevention. And so we're constantly trying to balance taking care of people that are sick now and preventing illness in the future. And one of the reasons that public health departments don't pay more attention to climate change, and I know this from having conducted a survey of about 115 public health people in California and the nation, is because of competing priorities. So huge amounts of resources have gone into preparing for pandemic flu and Ebola. I want to read you the full quote from the editor of the British Medical Journal when she published this call for a public health emergency. Deaths from Ebola infection, tragic and frightening though they are, will pale into insignificance when compared with the mayhem we can expect for our children and grandchildren if the world does nothing to check its carbon emissions, and action is needed now. So, once again, we really have to balance dealing with the perceived urgent needs of today and the fact that, like with tobacco and cancer, you can't make the cancer go away once you've smoked for 30 years. You have to stop smoking before you get there. And that's where we are with our fossil fuel use and climate change in terms of our future health impacts.
Thank you.
Thank you.
Senator Jackson, you have a question.
And I apologize for being late. There are so many other things happening. I don't know if you mentioned the whole issue of emerging bacteria and unknown diseases. I know when we held a hearing on emergency preparedness, that issue came up as the ocean temperatures increase and all these adjustments are made through the climate, and the possibility for some serious, unanticipated and unknowable kind or unknown kinds of bacteria and diseases. Did you mention that? And if you, and I apologize.
I did not mention that. I mean, we know that the risk for food and waterborne illness increases with warming temperatures. I don't think that we really know what the climate change risks mean in terms of new and emerging infectious diseases. We do know that climate change is already creating huge migration issues, and that as more and more people move around the world in response to losing their homes, or losing their ability to grow food, or losing their water, that we will see much more of the kind of travel that spreads any kind of new and emerging infectious diseases. And there's some recent estimates from the UN Office of Migration that suggests that, you know, as many as 200 million people are going to be climate refugees by the middle of the century. So that's a lot of people to be moving around.
Thank you.